I think we can start and allow the colleagues to join. Good evening, everyone. Dr. Karthik, please take over.
Thank you so much for joining, all of you. At the outset, I must thank Professor Rakeshani and Professor Satish Devpujari, our faculty who have kindly joined today, and welcome everybody, all the delegates who are already here, and our team from Medtrain also. So it's been a great journey this last 6 months, and I must say that I really enjoyed being one of the faculty members for this meeting. Just by chance that I happened, a great fortunate chance that I happened to meet Dr. Sridhar at a conference 2 years ago at the national conference, and he was very readily agreeable to join me in this journey. And after that, one by one, I spoke to all the faculty, and we drew up a nice kind of program, which I hope probably all of you have enjoyed listening to and reading all the videos. So I really am very thankful to Sridhar for having been very proactive and has developed the course content so well. And all this last 6 months, he has been interacting so well with all of you. Really very thank all our learned faculty, including the ones here already here, Professor Sani and Professor Devpujari, and the others like Dr. Vineet Bhandari and Dr. Kiran More, Ravzak, my own student, and many others whom we have all met during the course of the video presentations this last 6 months. So without much ado, I wanted to see what Dr. Sridhar would have to say about the course, and then we'll open the floor to the discussions, mostly from the faculty initially, some feedbacks, and later from the students. Please.
Yes, thank you, Dr. Karthik. I really thank you for taking me into this course and also supporting all through. And obviously, all of you, the faculty in this course, are legends in your own sense. And the students in this batch, we have been very lucky that we have had very enthusiastic people. Even though they're all busy clinicians, most of them are having their own setups, and it brings the experience and all the presentations. We all have learned from it. Each one of us, including you and me, have learned from their presentations and in-depth sharing of knowledge. And of course, the faculty's lectures have been excellent. And I have been lucky enough to watch through all of them and learn from them as well.
I should thank both of you for putting this together. Having a very similar course, which is going into done only condensed over 2 days, which will be going into its 33rd year. There is always a need for continued education, and in US in itself, and I wish this medicine, the rapidity with it's growing, the new modalities, the new concepts which come up every day, and the changes which we need to make to our practices, and only come through continued education and learning from people who've done this for a little while and can share with you. I think that's vital. And sometimes, as a physician, it's annoying, and the concept of continued education, other profession, after they have done their postgraduate exam, that's it. And but I think we deal with something very special, and being able to provide the best possible care only comes through continued education of the caretaker, and nothing better than this, something like this. And somebody told me once, if you take care of the respiratory care of the newborn, half of the battle is won. So I think providing good respiratory care, no matter what modality you use, you have to get the best at it and then deliver it to your patients, and the results will speak for themselves. So once again, Sridhar and Karthik, thank you for doing this, and I hope continued success. And if I can be of any help, not only to you guys, but to any of the participants, please feel free to reach out.
Thank you. A few words from you, please.
Sure. So yeah, I mean, I missed the initial bit. I'm rushing for a section, so I'm in the car. But I mean, cannot agree more than what Dr. Sani said. So I think, I mean, whenever even I always talk to the fellows, a lot of fellows, whenever they join, they're interested to learn hemodynamics, echo, and all those things. I tell them like the basic neonatology, the crux lies in the ventilation. You need to learn the art of ventilation. You will be able to manage most of the babies. That is a basic thing everyone need to master first, and that's why I think what I think this workshop is doing an excellent job of covering all the topic and art of ventilation, because I think that is where many times things go wrong. I'm seeing like still a lot of time people are still like practicing a very kind of a old school ventilation, maybe one mode only. I'm not again particular mode, but only SIMV I'm seeing in many places, and not using the modern machines optimally. There are so nice machines are now with flow sensors. They are a slave for us to do effective ventilation. We just need to learn the art of ventilation. And I think this workshop and the courses, I think this lectures which you are conducting, they're really excellent, and the discussions which are having really useful. So I would encourage everyone to make most out of it and make use of this in practice, and come up with some discussion during the interactive sessions. So that's all I would say.
Yes, sir. Hello, sir. Good evening. I want to, sir, just thank you and everyone. Like, I was very fortunate enough to join this course. I was actually I had actually joined Dr. Sridhar's Telegram channel, and then I got the link of this course, and I was just happy to jump in and join this. And I'm really very thankful that I have learned a lot of new concepts, and I have unlearned also a lot of concepts like that. So while my MD, we were not taught. I just completed my MD in 21, but a lot of ventilation concepts were wrong, which were taught to us. So this volume guarantee ventilation, and then the saturation targets, along with more focus on non-invasive ventilation. This was very new and knowledgeful to me, and I will try to apply this, and I will also try to circulate this thing among my colleagues, and and especially the initial modules of pulmonary mechanics, oxygenation, ABGA, and they were very important to us, because while MD we do not focus on those things. These things were read by us only in first or second year of MBBS. So thank you so much, sir. Thank you, everyone. All the lectures were so knowledgeable and so good. Thank you.
Thank you, Akansha.
Thank you, Akansha. It was a pleasure teaching you as well, and your presentation and your participation was very good. Dr. Gaurav, any comments?
Good evening, sir. I completely agree with Dr. Akansha that all the lectures were excellent, especially for all the students also. And it was an excellent learning for all of us. And the best thing is that we are able to implement those small changes in daily practice. And especially the basic, what we learned was also excellent. And really, it helped us a lot.
Thank you. And thank you, Dr. Jamila, for your comment as well.
Sir,
I'm glad that, remember that once you make these fine tunings, it stays with you and your whole team changes their approach. So it takes some time to unlearn, and as both of you said, to learn the less invasive or the minimizing intervention part. The nurses, they're always tuned to minimizing interventions more than the doctors. For some reason, the physicians think that doing more is better, but all of you are taking the right approach in minimizing your interventions and so on. Dr. Prithviraj, you had some interesting cases to share as well, and do you have any comments?
Sir, I felt the course was very useful to me actually. Based on the course inspiration only, I bought one ventilator also, sir, recently. Till now, I have not put the baby. Soon I will start, sir, and I will take the guidance from you, all of you actually. And it will be very helpful, sir.
What ventilator did you take?
Sir, one basic ventilator, sir, made in India only, JK Enterprises. It is having a simple mode, sir. CPAP, SMV, CMV, only these modes are there. Sir,
Most of the babies can be managed with such modes. Don't be feeling shy to take that. And made in India, we have to support the Indian stuff as well. So good, well done.
Yes, sir.
Dr. Kamaldeep, any comments?
Sir, yes, sir. I have learned a lot from this course. Many things like we have started HFNC in our SNCU now, and it's going well also. And many basic topics like point of care ultrasound, surfactant therapy, pulmonary graphics. Uh, these are all, matlab, everything is useful, but these are also very useful to me because I am working in a resource limiting setting. So these things are very helpful to me.
Yes. You, Dr. Mala, Dr. Nirmala. Dr. Nirmala, you had expressed some concerns in the beginning, but I hope you are able to keep pace towards the end and you focused on what was useful to you.
Good evening, sir. Hello.
Yeah, your voice is breaking.
Good evening, sir.
Good evening. Yeah.
Sir, this is best for me as I am working in SNCU, which is secondary level.
Yes.
But I have to manage many times tertiary center babies, sir.
Great.
This course gave me a lot of confidence. I'm using routinely Lisa and Insure techniques, sir, and CPAP.
Excellent.
Sir, many
That
concepts
makes,
are clear by this course, sir.
it makes it very positive for us to hear all this feedback from you. And if you have any suggestions, do mention in the group as well. And yeah, if you want to stay on in the group
Sir,
long term, I would appreciate that. Yeah.
sir, I like to hear one lecture, sir, on neonatal ECG, if possible.
ECG? Yeah, sure. I don't know if Dr. Karthik has. I will record it from him and put it on my channel. Don't worry. Dr. Sridhar is here. Hi, Dr. Sridhar. Thank you for joining. I hope you're getting better. Dr. Rakesh, you have raised your hand again, or it was from the beginning?
I made almost 8 notes. It's there with me. Notes of your all of your lectures.
Very nice.
And probably I will go through that 5-6 times, so that I will be masterized in ventilatory support.
Teach your juniors, teach your local people.
Yeah, definitely.
You have a strong voice. You will be a very good speaker.
Right. Thanks.
To Jamila, any comments? Your presentation was very nice about the very complicated baby and you did really well. You have any comments?
Jamila, is the baby doing well now?
Hello, sir. Am I audible?
Yes. Is the baby doing well? That was a very
yes. That baby was he's doing.
I think you got muted, Jamila.
Hello. Yeah. Yes,
Yeah.
sir. Yeah, the baby is now 7 months and his milestones are normal for age now.
Great. It was a very interesting case. All of us learned from it.
Yeah.
Very well managed. Do you have any comments on the course? Because you work overseas.
Actually, this course was an excellent course, sir. I have actually, for me, really it helped me to refresh and to keep me, updated every day with practice, not to get off away from the ventilation or respiratory physiology. Because as we don't get very often respiratory cases or NICU sick babies, very occasionally. So to keep us updated when we get a sick baby, it's good, sir. It's an excellent course, sir.
Yeah. Thank you. And any comments from anyone else? And thank you all for joining. I know we had a relatively lower attendance today, but understandable because we didn't have any specific teaching agenda. And most of you are quite worried about the exam. But again, I reassure you that myself and Dr. Karthik have made it clinical. So don't be too worried about it. And our aim is not to pass or fail. It's most of you have done really well otherwise. So don't be worried. With that, I think we'll close. Dr. Karthik, do you want to close with your final word?
No, I really appreciate all of you joining us in this first course and having reposed so much faith on us. And we are trying to fine tune this course so that over the years it will become probably one of the best recognized courses for ventilating newborns. And you being the pioneer in this field and you being the first batch, you will always be after our hearts. And therefore, you'll have a special place in our heart. And We really want you all to keep putting your thoughts about the course even after you finish the exam about how best we can further fine tune it. You being the alumni of this course will be at a great advantage because later, once this course, hopefully over the next few years, becomes quite popular and well respected, being a faculty and being a alumnus of this course, you'll probably get a lot of benefits to derive from this. So thank you so much, all of you. It was very, very nice having you join this course. We'll always remain friends for life. So we'll close this session now. Only